Picture this, March 15, 2015, 11:47 p.m. Emergency sirens pierce the night air outside St. Luke's Medical Center in Chicago. But the ambulance isn't arriving, it's already there. The patient? Sarah Chen, a 28-year-old ICU nurse who just fell 7 stories from the hospital's rooftop. What the police report won't tell you is what happened to her diary, what the hospital administration buried, and why 3 other staff members requested transfers within 48 hours of her death. If stories like this make you question what really happens behind hospital doors, hit that like button, because what you're about to hear will change how you see healthcare forever. Dr. Michael Torres had been chief of internal medicine at St. Luke's Medical Center for exactly 11 months when he found Sarah Chen's diary. Not in her locker, where the hospital administration claimed to have searched. Not in her apartment, where Chicago PD had combed through every drawer. He found it wedged behind a loose heating vent in the physician's break room on the 7th floor, the same floor she'd jumped from. It was 6:23 a.m. on March 17, 2015, just 2 days after Sarah's death. Torres had been pulling another 18-hour shift, the 3rd that week, when he'd noticed the heating wasn't working properly in the break room. Being the kind of person who fixed things himself rather than wait for maintenance, he'd grabbed a screwdriver and started investigating the vent cover. The diary fell out like a confession waiting to be heard. Sarah's handwriting was precise, methodical. Exactly what you'd expect from someone who'd spent 4 years documenting patient vitals and medication dosages. The entries started innocuously enough, dating back to January 2015, when she'd first transferred to the ICU from the general ward. January 12, 2015, first week in ICU. Dr. Hendricks seems nice enough, though the other nurses warned me he can be demanding. Mrs. Patterson in bed 7 is responding well to the new cardiac protocol. Her daughter visits every day at 2 p.m. sharp. Torres flipped through the pages, noting how Sarah's tone gradually shifted from optimistic to concerned to something approaching fear. February 3, 2015. Something's not right with the medication counts. Morphine keeps coming up short, but Dr. Hendricks says it's normal variance. Asked Janet about it. She just looked at me funny and said, "New girls always ask too many questions." Dr. James Hendricks. Torres knew him well, a respected cardiologist who'd been with St. Luke's for over 15 years. Impeccable reputation, published researcher, the kind of doctor medical students aspired to become. But as Torres continued reading, a different picture of Hendricks began to emerge. February 18, 2015. Caught Dr. Hendricks in the supply closet at 11:30 p.m. He said he was checking inventory, but he had 3 vials of morphine in his lab coat. When I asked if he needed help with documentation, he got angry. Told me to mind my own business and focus on my patients. Torres felt his coffee grow cold as he read. Outside the break room, the morning shift was beginning. The familiar sounds of nurses making rounds, breakfast carts rolling down corridors, the rhythmic beeping of monitors that formed the soundtrack of hospital life. But inside this small room, Sarah's words painted a picture of an institution he barely recognized. March 2, 2015. It's not just the morphine. I've been tracking the controlled substances for 3 weeks now. Fentanyl, oxycodone, even some of the newer pain medications. The numbers don't add up. When I brought my documentation to head nurse Wilson, she said there must be some mistake in my counting. But I've triple-checked everything. Torres knew head nurse Patricia Wilson personally. They'd worked together on the hospital's pain management committee, had shared coffee during countless night shifts, had celebrated her 25th anniversary with St. Luke's just last year. The idea that Patricia would dismiss legitimate concerns from a nurse seemed impossible. But Sarah's entries became increasingly detailed, almost forensic in their precision. March 5, 2015, patient in bed 12, Mr. Rodriguez, post-operative day 3 from cardiac bypass. Chart shows he received 4 milligrams morphine at 2 a.m., 6 a.m., and 10 a.m. But I was his nurse for the entire shift. He only received the 2 a.m. dose. Someone's been altering the records. Torres stopped reading and checked his watch. 6:41 a.m. In 19 minutes, Dr. Hendricks would arrive for morning rounds. Patricia Wilson was probably already in her office, reviewing the night reports. These people he'd worked alongside, respected, trusted. Sarah's diary was suggesting something that seemed impossible to believe. He continued reading, drawn deeper into Sarah's increasingly isolated world. March 8, 2015, tried to talk to Dr. Martinez about the discrepancies. She listened, seemed concerned, said she'd look into it. 3 hours later, Dr. Hendricks called me into his office. Knew exactly what I'd discussed with Martinez. Someone's been reporting back to him. Feel like I can't trust anyone. The entries revealed a young nurse caught in an impossible situation. Sarah had done exactly what she'd been trained to do: document irregularities, report concerns through proper channels, advocate for patient safety. But instead of finding support, she'd encountered a wall of indifference and, increasingly, hostility. March 10, 2015, had a meeting with administration today. Mr. Caldwell from Risk Management, Patricia, and Dr. Hendricks all there. They said my accusations were serious and potentially damaging to staff morale. Told me I needed to be more careful about spreading unsubstantiated concerns. Felt like I was being interrogated, not heard. Torres recognized the names. Robert Caldwell, Risk Management Director, a man whose job was theoretically to protect patients but practically seemed more focused on protecting the hospital from lawsuits. The meeting Sarah described sounded less like an investigation and more like damage control. March 12, 2015, can't sleep. Keep thinking about Mrs. Patterson's daughter, how she trusted us to take care of her mother. How all these families trust us. If I'm right about what's happening, people are suffering. If I'm wrong, I'm destroying careers and relationships. But the numbers don't lie. 3 days before her death, Sarah's final entries took on a desperate quality. March 13, 2015, found out Dr. Hendricks has been calling other hospitals about me, using words like unstable and paranoid. My reputation is being destroyed. Applied for 3 positions this week. Suddenly no one's returning my calls. March 14, 2015, Patricia told me I'm being transferred back to general ward for my own good. Says the ICU is too stressful for someone of my temperament. After everything I've documented, everything I've tried to do the right way, they're treating me like I'm the problem. The final entry was dated March 15, 2015, the day she died. March 15, 2015, going to make copies of everything today. All the documentation, all the evidence. Someone needs to know the truth about what's happening here. If something happens to me, I need people to understand I wasn't crazy. I wasn't making this up. The patients deserve better. They deserve the truth. Torres closed the diary, his hands trembling slightly. Outside, he could hear the familiar voice of Dr. Hendricks greeting the morning staff, the same warm, professional tone Torres had heard hundreds of times. But now it sounded different, calculated, performative. Sarah Chen had jumped from the rooftop at 11:47 p.m. on March 15. According to her diary, she'd spent that day making copies of evidence. Evidence that the hospital administration claimed never existed. Evidence that had supposedly been thoroughly investigated and found to be baseless. But if Sarah had made copies, where were they now? And why had her diary been hidden in a heating vent instead of logged as part of her personal effects? Torres looked at his watch again. 6:58 a.m. In 2 minutes, he had morning rounds. In 2 minutes, he'd have to walk into that ICU, look at his colleagues, and pretend he hadn't just discovered that everything he thought he knew about his workplace might be a lie. He slipped the diary into his lab coat pocket and headed for the door. But as he reached for the handle, one question echoed in his mind. If Sarah Chen was right about the drug diversion, and if the hospital had covered it up after her death, what else were they hiding? Dr. Torres spent the next 72 hours conducting his own investigation, and what he discovered made Sarah's concerns seem conservative by comparison. It started with the medication logs. As chief of internal medicine, Torres had legitimate access to controlled substance records, but he'd never had reason to scrutinize them closely. Now, armed with Sarah's specific dates and patient information, patterns began to emerge that chilled him to the bone. March 18, 11:30 p.m. Torres sat in his office, the only light coming from his computer screen as he cross-referenced Sarah's handwritten notes with the official electronic records. Patient Rodriguez, the cardiac bypass case Sarah had mentioned. His electronic chart showed a textbook post-operative pain management protocol. But when Torres pulled the physical nursing notes from medical records, a different story emerged. The handwritten entries, initialed by 3 different nurses across multiple shifts, documented significantly less pain medication than what appeared in the computer system. Someone had been systematically altering the electronic records, creating phantom drug administrations that existed only in the digital realm. Torres pulled 10 more cases from Sarah's notes. The pattern was consistent: electronic records showing appropriate pain management, handwritten nursing notes documenting less medication actually given, and the difference unaccounted for in the controlled substance inventory. The scope was staggering. Over the 2 months Sarah had been documenting irregularities, Torres calculated that approximately 400 individual doses of various opioids had been diverted. Street value: somewhere between $15,000 and $20,000. But the financial aspect wasn't what kept Torres awake that night. It was the realization that patients had been suffering. Post-operative cardiac patients, many elderly, some terminal, people in genuine pain who'd been systematically under-medicated so someone could steal their relief. March 19th brought Torres face-to-face with Janet Kowalski, the senior ICU nurse Sarah had mentioned. Janet had been at St. Luke's for 12 years, was known for her clinical expertise and her mentorship of newer nurses. But when Torres casually asked her about Sarah Chen during their morning coffee, Janet's reaction was immediate and telling. "Poor girl was overwhelmed," Janet said, not meeting Torres's eyes. "The ICU isn't for everyone. Some people see problems that aren't there when they're under stress." "What kind of problems?" Torres pressed gently. Janet's hands tightened around her coffee cup. She was seeing patterns in everything. Conspiracy theories about medication counts, accusations about other staff. Patricia tried to help her, tried to get her moved to a less stressful environment, but Sarah took it personally. It was a carefully constructed narrative, Torres realized. Sarah as the unstable newcomer, her concerns as delusions brought on by stress, her transfer as a compassionate intervention. But it didn't explain why her diary had been hidden, or why the evidence she'd documented was so meticulously detailed. That afternoon, Torres took a calculated risk. He requested a meeting with Robert Caldwell from Risk Management, using his position as department chief to frame it as a routine quality assurance discussion. Caldwell's office occupied a corner of the administrative wing, its windows offering a clear view of the hospital's main entrance. As Torres sat across from the risk management director, he couldn't help but note that this same window would have provided a perfect view of the ambulance arriving to collect Sarah's body 3 nights earlier. "I've been reviewing some of our controlled substance protocols," Torres began carefully, "and I wanted to get your thoughts on our current monitoring systems." Caldwell, a heavy-set man in his 50s with the measured demeanor of someone accustomed to managing crises, leaned back in his chair. "Any particular concerns, Dr. Torres?" "Nothing specific," Torres lied smoothly. "But I know we had some questions raised recently by one of our ICU nurses before her unfortunate death. I want to make sure we've addressed any potential vulnerabilities." The change in Caldwell's demeanor was subtle but unmistakable. His posture straightened, his eyes became more focused. "Ah, you mean Nurse Chen?" "Yes, we conducted a thorough investigation of her concerns. Found them to be unsubstantiated." What exactly did she claim? Caldwell pulled out a thin file from his desk drawer. Surprisingly thin, Torres noted, for what Sarah's diary suggested had been weeks of documented evidence. Medication count discrepancies, primarily. Some concerns about record-keeping. We reviewed everything with pharmacy, nursing administration, and the attending physicians. No irregularities found. Torres nodded thoughtfully. Did she provide specific documentation? Patient names, dates, that sort of thing. Some handwritten notes, Caldwell said dismissively. But you have to understand, Dr. Torres, Nurse Chen was under significant stress. New position, demanding environment. Sometimes people see patterns that aren't there. It was the same narrative Janet had provided, almost word for word. But Torres pressed on, what happened to her documentation? I'd be interested in reviewing it for training purposes, helping other new staff understand proper reporting procedures. For the first time in the conversation, Caldwell hesitated. I believe it was returned to her personal effects after the investigation concluded. But Torres knew that wasn't true. He'd spoken with Sarah's sister, who'd collected her belongings from the hospital. No work-related documents had been included, only personal items like photographs and a few books. That evening, Torres made a decision that would change the trajectory of his career and, ultimately, his life. He began his own systematic review of controlled substance records, not just for the ICU, but for the entire hospital. What he discovered over the next 2 days was a pattern of drug diversion that extended far beyond what Sarah had documented. The ICU was just the most recent target. Over the past 18 months, similar discrepancies appeared in emergency medicine, post-surgical care, and even the oncology ward, places where high-dose pain medications were routinely prescribed and where small diversions might go unnoticed. The sophistication of the operation was remarkable. Electronic records were being altered by someone with administrative access, creating digital paper trails that would satisfy most audits. Physical nursing notes, the handwritten records that served as backup documentation, were being collected and disposed of outside normal retention protocols. And any staff member who noticed irregularities was being systematically discredited, transferred, or pressured to leave. Sarah Chen hadn't been paranoid. If anything, she'd only scratched the surface. March 21st, Torres faced a choice that every healthcare professional hopes never to encounter. Remain silent and complicit, or risk everything to expose what he'd discovered. The decision was made for him when he received an unexpected visitor. Dr. Elena Martinez knocked on his office door at 8:15 p.m., long after most of the administrative staff had gone home. Torres remembered her from Sarah's diary entries, the physician Sarah had initially trusted, who'd seemed concerned about the medication discrepancies. "Dr. Torres," she said, closing the door behind her, "we need to talk." Martinez was a slight woman in her early 40s, an emergency medicine physician with a reputation for clinical excellence and ethical integrity. But tonight, she looked exhausted and frightened. "It's about Sarah Chen," she continued, "and about what's been happening in this hospital." Torres felt his pulse quicken. "What about Sarah?" "She came to me 3 weeks before she died. Had documentation, evidence of systematic drug diversion. I told her I'd look into it." Martinez's voice dropped to almost a whisper. "Within hours, I was called into a meeting with Hendricks and Caldwell. They knew exactly what Sarah had told me." "What did they say?" "That Sarah was emotionally unstable. That her accusations were false and potentially defamatory. That continuing to entertain her delusions could be harmful to patient care and staff morale." Martinez sat down heavily in the chair across from Torres's desk. "They were very persuasive, and very clear about the consequences of not being a team player." Torres leaned forward. "You think they killed her?" "I think they destroyed her systematically and completely. Her reputation, her career, her credibility. By the time they were done, Sarah Chen felt like she had no choice but to jump from that rooftop. Martinez met his eyes. "And I think if we're not very, very careful, we could be next." The breakthrough came from an unexpected source. Maria Santos, a night shift pharmacist who'd been quietly documenting irregularities for over 6 months. Dr. Martinez arranged the meeting for March 23 at 2:30 a.m. in the hospital's chapel, one of the few places in St. Luke's without security cameras. Torres arrived first, followed by Martinez, and finally Maria, a soft-spoken woman in her 30s who'd been with the hospital for 8 years. "I knew Sarah was right," Maria said without preamble, pulling out a thick manila folder from her purse. "But I was too scared to speak up. After what happened to her, she trailed off, then steeled herself. I can't stay quiet anymore." The folder contained photocopies of controlled substance logs, pharmacy inventory reports, and medication distribution records dating back 14 months. Maria had been methodically documenting every discrepancy, every irregularity, every moment when the numbers didn't add up. "It's not just Dr. Hendricks," she explained as Torres and Martinez reviewed her evidence. "He's part of it, but he's not running it. This is organized, systematic. Someone with administrative access is coordinating everything." The records painted a picture of an operation far more sophisticated than Torres had imagined. Drugs were being diverted through multiple methods. Phantom prescriptions entered into the system for patients who'd been discharged, medications wasted, but never actually disposed of, and systematic underdosing of patients in chronic pain. But the most disturbing revelation was the patient selection criteria. The diverters weren't targeting random cases. They were specifically choosing vulnerable populations. Elderly patients with limited family involvement, terminally ill patients whose pain management was complex and variable, and patients with histories of substance abuse whose complaints about inadequate pain relief would be dismissed. "Look at this," Martinez said, pointing to a section of Maria's documentation. February 15th through March 1st. Every patient who was significantly under-medicated was either over 75, had a terminal diagnosis, or had addiction issues noted in their chart. Torres felt sick. These weren't opportunistic thefts. They were calculated decisions to inflict suffering on the most vulnerable patients in the hospital. Maria continued, "The electronic records are being altered by someone with supervisory access to the pharmacy system. Not just any pharmacist can make these changes. You need administrative privileges." "Who has that level of access?" Torres asked. "3 people," Maria replied. "The chief pharmacist, the assistant director of pharmacy, and—" She hesitated. "And Robert Caldwell from risk management. He was given system access last year as part of a quality assurance initiative." The pieces were falling into place. Caldwell wasn't just covering up the drug diversion, he was orchestrating it. His position gave him access to multiple systems, insight into ongoing investigations, and the authority to discredit anyone who came too close to the truth. "There's something else," Maria added, her voice barely audible in the empty chapel. Sarah wasn't the first person to raise concerns about this. She pulled out another set of documents. 18 months ago, there was another nurse in the emergency department, Kevin Walsh. He filed a formal complaint about medication irregularities. 3 weeks later, he was terminated for allegedly making medication errors that only appeared in the electronic records after his complaint was filed. Torres remembered Kevin vaguely. A competent nurse who'd left suddenly amid rumors of professional misconduct. Like Sarah, his concerns had been dismissed as paranoid delusions. Like Sarah, his documentation had disappeared. And 6 months before that, Maria continued, Dr. Patricia Kim in oncology. She questioned why her terminal patients seemed to be experiencing more pain than expected given their medication regimens. She requested a pain management consultation review. A week later, she received a poor performance evaluation citing concerns about her clinical judgment. She transferred to another hospital within a month. The pattern was clear and chilling. identify staff members who notice the diversion, discredit their concerns, destroy their reputations, and drive them away before they could build a case. Those who persisted, like Sarah, faced increasingly desperate measures. How many patients have been affected? Torres asked. Maria had calculated it meticulously. Based on my records, approximately 1,200 individual instances of medication diversion over the past 14 months. That's 1,200 times a patient received less pain relief than they needed and deserved. The scope was staggering. Hundreds of people suffering unnecessarily so that a handful of hospital staff could steal and sell their medication. But Maria's most damaging revelation was yet to come. "I know where the drugs are going," she said, pulling out her phone and showing them a series of photographs. "Dr. Hendricks has a son, Michael. 26 years old, lives in Lincoln Park. I followed the medications." The photos showed a young man meeting various individuals in parking lots, brief exchanges that clearly involved money and small packages. Michael Hendricks wasn't just using the stolen medications, he was distributing them. "Dr. Hendricks isn't just stealing drugs," Maria explained. "He's running a distribution network using his son as the street-level dealer. And Caldwell is providing the administrative cover to make it all work." Torres felt the weight of the revelation. This wasn't just about healthcare workers with addiction problems stealing medications for personal use. This was a criminal enterprise operating within the hospital, using patient suffering as raw material for profit. "We need to go to the police," Martinez said. But Maria shook her head. "We need more than documentation. We need testimony from someone on the inside, someone who can confirm the operational details." "Who?" Torres asked. "Patricia Wilson," Maria replied. "The head nurse. She's been signing off on altered medication counts for months. She has to know what's happening." The idea of approaching Patricia Wilson seemed impossible. She was part of the administrative structure that had silenced Sarah, part of the system that had covered up the diversion. But Maria had a different perspective. "Patricia's daughter is a nurse at Northwestern Memorial," she explained. "I know her personally. Last month, she mentioned that her mother has been having trouble sleeping, seems stressed all the time. I think Patricia knows she's part of something wrong, but she's trapped." It was a reasonable theory. Patricia Wilson had been at St. Luke's for 25 years, had built her career and reputation there. Discovering that she was being used to facilitate a criminal enterprise would be devastating. But it might also make her willing to cooperate if approached correctly. "I'll talk to her," Torres decided. "As department chief, I can request a private meeting about ICU protocols. If I'm careful, I might be able to gauge where she stands." Martinez looked skeptical. "And if she reports the conversation to Caldwell? Then we'll know we're on our own," Torres replied. "But if she's willing to help us, we might have enough to build a real case." The meeting broke up at 3:15 a.m. with a plan. Torres would approach Patricia Wilson within the next 48 hours. Maria would continue documenting everything while maintaining her normal routine. Martinez would quietly reach out to contacts at the Chicago Police Department to understand how to properly report healthcare fraud. As Torres walked back through the empty hospital corridors, he passed the elevator that led to the rooftop where Sarah Chen had died. The official investigation had concluded within 72 hours. Suicide by a mentally unstable nurse unable to handle the stress of ICU work. But Torres now knew the truth. Sarah hadn't jumped because she was crazy or overwhelmed. She jumped because she discovered a criminal conspiracy, tried to report it through proper channels, and found herself isolated, discredited, and professionally destroyed by the very people she'd trusted to do the right thing. The question now was whether Torres, Martinez, and Maria would be able to succeed where Sarah had failed, or whether they would become the next casualties in a system designed to protect itself at any cost. As he reached his office, Torres made a decision that Sarah Chen never had the chance to make. He began preparing evidence packages to be sent to federal authorities, media contacts, and medical licensing boards simultaneously. If something happened to him, the truth about St. Luke's Medical Center would still see the light of day. But first, he had to convince Patricia Wilson to help them bring down the conspiracy that had cost Sarah her life. The confrontation with Patricia Wilson took place on March 25, 2015, at 7:15 a.m. in her office overlooking the ICU. Torres had chosen the timing carefully, early enough to ensure privacy, late enough that Patricia would have completed her night shift paperwork and be mentally focused. Patricia was a woman in her early 50s, with graying hair pulled back in a practical bun and eyes that had seen 25 years of hospital life. But when Torres closed her office door and asked if they could speak privately about some irregularities in the ICU, those experienced eyes showed something Torres had never seen before: fear. "What kind of irregularities?" she asked, though her tone suggested she already knew. Torres pulled out Sarah's diary and placed it on her desk. Patricia's reaction was immediate and telling. She recoiled as if the small notebook were radioactive. "Patricia," Torres said gently, "I know what's been happening. I know about the drug diversion, about Caldwell and Hendricks, about the systematic cover-up. And I know you've been caught in the middle of it." For nearly 30 seconds, Patricia said nothing. Then, slowly, her professional composure crumbled. "I never wanted any of this," she whispered. "When Caldwell first asked me to adjust some medication records, he said it was to correct documentation errors. Simple mistakes that needed fixing for audit purposes." "When did it start?" 14 months ago. Just small changes at first, adjusting dosing times, correcting patient identification numbers. Then it became larger alterations. Entire medication administrations that needed to be documented after the fact. Patricia's hands were shaking. By the time I realized what was really happening, I was too deep in it to get out. Torres leaned forward. "Caldwell was blackmailing you?" "Not exactly blackmail. But he made it clear that I'd been signing falsified records for months. If the truth came out, I'd lose my license, face criminal charges, lose my pension." She looked up at Torres with desperate eyes. "I'm 53 years old. I can't start over." It was a classic manipulation tactic: gradually increase someone's complicity until they're too compromised to resist. Patricia had been slowly transformed from unwitting accomplice to essential co-conspirator. "What about Sarah?" Torres asked. Patricia's face crumpled. Sarah was so dedicated, so thorough. She noticed everything, documented everything. When she first came to me with concerns, I hoped I could discourage her quietly. But she kept digging. "So you reported her concerns to Caldwell?" "I had to. He'd already told me that any unusual questions or investigations needed to be reported immediately. If I hadn't told him, and he found out later..." Patricia trailed off. "What happened in that final meeting?" "March 12th, 3 days before she died." Patricia was crying now, tears flowing silently down her cheeks. Caldwell was furious. Said Sarah was becoming a threat to the entire operation. Hendricks wanted to have her fired immediately, but Caldwell said that would raise too many questions. So what was the plan? Destroy her credibility completely. Make her seem paranoid, unstable. Transfer her to a position where she couldn't access ICU records. And if that didn't work... Patricia's voice dropped to a whisper. Caldwell said there were other options. Torres felt a chill run through him. "You think they pushed her?" "I don't know. I honestly don't know. But Sarah left that meeting looking destroyed." Caldwell had been so clinical about it, talking about managing the problem and protecting the operation. She realized that no one was going to help her, that she was completely alone. The picture was becoming clearer. Sarah hadn't jumped because she was mentally ill. She jumped because she'd been systematically isolated and terrorized by people she'd trusted, people who'd made it clear that her career, her reputation, and possibly her safety were at risk if she continued pursuing the truth. Patricia continued. The next day, Caldwell told me that Sarah had been asking about making copies of documents. He wanted me to search her locker, her workstation, anywhere she might have hidden evidence. Did you find anything? No. But Caldwell was convinced she'd made copies. He was worried about what would happen if they surfaced after her death. Torres realized that Sarah's decision to hide her diary in the heating vent had been prescient. She'd known that her personal belongings would be searched, that any evidence she'd compiled would disappear. Patricia, Torres said carefully, I need your help to make this right. Not just for Sarah, but for all the patients who've been hurt by this. She looked up at him with a mixture of hope and terror. What do you want me to do? Help us document everything. Provide testimony about how the operation worked, who was involved, how long it's been going on. We have evidence, but we need someone on the inside to confirm the details. Caldwell will destroy me. Caldwell's going to be arrested, Torres replied with more confidence than he felt. The FBI is already investigating healthcare fraud at several Chicago hospitals. When we present our evidence, this becomes a federal case. It was a slight exaggeration. Martinez had made contact with federal authorities, but the investigation was still in preliminary stages. However, the mention of FBI involvement had the desired effect on Patricia. Over the next 2 hours, Patricia Wilson provided a complete account of the drug diversion operation. The scope was even larger than Torres had imagined. The conspiracy involved 5 core participants: Dr. Hendricks as the medical authority who could justify unusual prescribing patterns, Caldwell as the administrative coordinator with system access, Patricia as the nursing supervisor who could alter documentation, Assistant Pharmacy Director David Chen, no relation to Sarah, who facilitated drug transfers, and Michael Hendricks as the street-level distributor. The operation had generated an estimated $180,000 in revenue over 14 months, with drugs being sold through Michael's network in Lincoln Park and surrounding neighborhoods. Patients had been systematically under-medicated, with the stolen medications creating a secondary market for prescription opioids. Most disturbing of all, the group had been discussing expansion. Caldwell had been exploring similar arrangements at 2 other Chicago hospitals where he had consulting relationships. There's something else, Patricia added as their conversation neared its end. The day after Sarah died, Caldwell called an emergency meeting. He seemed almost relieved. Said that Sarah's death would serve as a warning to other potential troublemakers. Torres felt nauseated. Whether or not they directly caused Sarah's death, the conspirators were certainly using it as psychological warfare against anyone else who might consider reporting their crimes. The resolution came swiftly once federal authorities became involved. On April 2, 2015, coordinated arrests took place at St. Luke's Medical Center and Michael Hendricks's apartment. The evidence Maria had compiled, combined with Patricia's testimony and Torres's documentation, provided federal prosecutors with a comprehensive case. Dr. James Hendricks was sentenced to 8 years in federal prison for healthcare fraud, drug trafficking, and conspiracy. His medical license was permanently revoked. Robert Caldwell received a 12-year sentence as the operations coordinator, with additional charges related to obstruction of justice and witness intimidation. Patricia Wilson, in exchange for her cooperation, received a 2-year suspended sentence and permanent loss of her nursing license. She testified that while she deeply regretted her involvement, Sarah Chen's death had made her realize she couldn't continue being complicit in the operation. David Chen and Michael Hendricks received sentences of 4 and 6 years respectively. But the institutional changes were perhaps more significant than the individual prosecutions. St. Luke's Medical Center implemented new controlled substance monitoring systems, independent oversight procedures, and whistleblower protection policies. The hospital also established the Sarah Chen Patient Advocacy Fund, providing resources for staff members to report concerns without fear of retaliation. Dr. Torres left St. Luke's 6 months after the arrests, accepting a position at Northwestern Memorial where he now serves as Director of Medical Ethics. He keeps Sarah's diary in his desk drawer, a reminder of the courage it takes to speak truth to power and the price of remaining silent in the face of wrongdoing. The rooftop of St. Luke's Medical Center was sealed off permanently following Sarah's death. But in the chapel where Torres, Martinez, and Maria first met to plan their investigation, there's now a small plaque that reads, "In memory of Sarah Chen, RN, who believed patients deserved better." Sarah Chen's diary was eventually returned to her family, along with a formal apology from St. Luke's Medical Center and a settlement that funded nursing scholarships at the University of Chicago. Her sister, Lisa Chen, used the occasion to speak about the isolation and pressure that healthcare workers face when they witness wrongdoing. Sarah wasn't suicidal, Lisa told reporters. She was a woman of integrity who found herself in an impossible situation. She tried to do the right thing through proper channels, and when that failed, she felt she had no choice but to take drastic action to ensure the truth would eventually come out. The Sarah Chen case became a landmark in healthcare whistleblower protection, cited in federal legislation and medical ethics curricula across the country. But perhaps more importantly, it serves as a reminder that behind every hospital room door is a human being trusting their care to strangers, and that trust is sacred. Dr. Torres still receives letters from patients and family members who were affected by the drug diversion scheme. Many express gratitude that someone finally listened, finally acted. But others describe lasting trauma from inadequate pain management, from suffering that didn't need to happen. In the end, Sarah Chen's death wasn't in vain. It exposed a criminal conspiracy and led to reforms that protect both patients and healthcare workers. But it also serves as a sobering reminder of what can happen when institutions prioritize self-protection over patient care. The heating vent where her diary was hidden has been sealed, but maintenance workers at St. Luke's still talk about the young nurse who tried to save her patients and ended up saving the entire hospital from its own corruption. Sometimes, the most important truths are hidden in the most unlikely places, waiting for someone brave enough to look. Sarah Chen's story raises difficult questions about institutional accountability and the protection of healthcare whistleblowers. What would you have done in her situation? Have you ever witnessed wrongdoing in a workplace and struggled with whether to report it? Share your thoughts in the comments below, and if you believe healthcare workers deserve better protection when reporting patient safety concerns, subscribe to Ward 13 for more stories that expose the hidden realities of medical institutions. Remember, patients trust us with their lives, and that trust demands absolute integrity.